Everybody, my name is John Ward. I'm Communications Director for the ACLU of Massachusetts. I want to thank everyone for joining today's ACLU of Massachusetts virtual town hall. We hope you and your loved ones are staying safe and well. You'll hear shortly from ACLU experts about how this pandemic is impacting voting and abortion rights. But first, I want to go over a few technical notes. This is a Zoom webinar, so you'll not be able to hear or see yourself. You'll be automatically muted. You will only be able to see and hear the speakers. If you have any technical questions throughout this presentation, please ask us in the chat function on the right-hand side of your screen. The chat function will also be used for us to share resources and actions with you, so pay attention to what we're putting in there. There is a question and answer function as well. We encourage you to use that question and answer function to send us questions for our panelists. We did receive several questions in advance via email and social media, so you'll have to be patient with us if we don't get to them immediately. We'll hear about abortion rights first from Deputy Legislative Director Oamshri Amarasingham and Legislative Director Gavi Wolfe, followed by a brief question and answer period. Then we'll hear about voting rights from Racial Justice Program Director Rahsaan Hall, followed by, again, a brief question and answer section. And then finally, Carol Rose, our Executive Director, will offer some closing remarks. Now, I'd like to introduce Oamshri to you to talk about abortion rights. Thanks so much, Oamshri.
Thank you, John. And thanks, everyone, for joining us today. As we all do our best to protect the health and well-being of family and friends in this unsettling time, the need for a government response guided by public health has become more urgent than ever. That includes ensuring reproductive health care remains accessible and open to all who need it. States across the country have issued orders to postpone non-essential surgeries and other medical procedures. Most states have left it up to doctors and other healthcare professionals to determine what is essential. And health experts agree. Abortion is essential and time-sensitive healthcare, and access must not be compromised during this pandemic. But 9 states have exploited the COVID-19 crisis to strip access to abortion and push reproductive healthcare out of reach. Arkansas, Alabama, Iowa, Louisiana, Ohio, Oklahoma, Tennessee, Texas, and West Virginia. Restricting access to healthcare is an affront to our rights at any time, but during a pandemic, the consequences are even more dire. The ACLU and other advocacy groups have sued in all 9 states. So far, courts have blocked at least some part of the new restrictions in Alabama, Ohio, Oklahoma, and Tennessee. Recently, after ACLU litigation, a federal court blocked Tennessee officials from enforcing a local zoning rule that was enacted to stop reproductive healthcare clinics from providing abortions in Mount Juliet. In Alabama, an appellate court has ensured that abortion care can continue in the state. And in Ohio and Oklahoma, the ACLU and other groups successfully protected access to abortion during the pandemic. But we know the fights in these states and several others are far from over. Some states are seeking to appeal, and others continue to find new ways to push abortion out of reach. Take Arkansas. Last month, the 8th Circuit Court of Appeals issued an opinion allowing the state to ban abortion during a pandemic. The ACLU filed emergency legal action asking a judge to intervene and preserve access where a delay would mean forcing patients to continue pregnancies against their will. Meanwhile, the Arkansas Department of Health issued a new directive mandating that patients test negative for COVID-19 within the 48 hours before their abortion. This policy requires a patient to jump over 3 hurdles before accessing abortion. First, a patient would have to find a test, and we all know that testing resources are in short supply everywhere. Second, the patient would have to receive the results within the 48 hours of their appointment, a process a patient has no control over. Finally, the person would have to test negative for a virus that is spreading rapidly throughout the world. These are insurmountable barriers that serve only to prevent people from accessing essential healthcare. The ACLU filed another emergency legal action in Arkansas to block this directive, but unfortunately, just last week, a federal court denied our motion. The government should never prevent people from making a decision about a pregnancy that is best for themselves and their families. But doing so during a pandemic, when people are losing their jobs and doing everything they can just to keep their families healthy and make ends meet, is beyond cruel. It's no coincidence that the states using the pandemic to curtail access to abortion are the same states that were already working to infringe on this right. Now more than ever, states like Massachusetts must continue to prioritize abortion care. To talk more about abortion access in the Commonwealth. I'd like to introduce Gavi Wolfe, Legislative Director at the ACLU of Massachusetts.
Thank you, Omi, and thanks everyone for being here. I hope all of you at home are safe and well. Before I jump into talking about our work to protect and expand abortion access in Massachusetts, I want to provide some context. The Massachusetts state legislature is one of the few around the country that has continued to operate at all over the last few months, but the nature of their work has changed significantly. First, members of the legislature have shifted focus almost exclusively to working on emergency legislation to deal with the impacts of the COVID-19 pandemic. They've helped constituents who have lost jobs. They're working to support our medical community and those who are on the front lines. And as you'll hear later on, they're also working to make sure no one has to choose between protecting their health and exercising the right to vote this fall. But physical distancing guidelines mean legislators are not coming together to vote at the State House. They're working remotely. Until recently, the legislature's modified operations have meant that they only held informal sessions when formal roll call votes are not required. Instead, everyone has to agree on an issue for it to move forward. As a result, they've only been passing consensus emergency measures. However, just last week, the legislature adopted new procedures for remote voting that will allow them to conduct debates and roll call votes, and they're beginning to test out those new procedures. We hope that means they will soon be able to turn their attention to a wider range of issues, including matters like abortion access. The ACLU, together with NARAL and Planned Parenthood, has been strongly advocating for a bill that would improve and expand abortion access in Massachusetts. Called the ROE Act, the bill would remove barriers to abortion, including obstacles that force patients to travel out of state or make young people go before a judge in order to access care. The ROE Act remains in the Judiciary Committee, and they have recently sought to extend the deadline for them to report it out until July 31st. We believe the full legislature will quickly approve that extension, giving us more time to continue our advocacy. For all the reasons Omi just described, Massachusetts must continue to prioritize abortion care. Early on in the pandemic, Governor Baker temporarily banned elective medical procedures, but he rightly designated abortion as essential health care that must not be cut off. But that recognition does not address barriers to care that still exist in Massachusetts, barriers that are only made worse by the pandemic. Pregnant people who receive a fatal fetal diagnosis later in pregnancy still cannot seek abortion care here in Massachusetts. They must travel across the country for care, which has become all but impossible in light of strict COVID-19 prevention measures. Young people who can't talk to their parents about pregnancy must still navigate the court system and face a judge and deal with new logistical hurdles around remote hearings before seeking basic health care. These obstacles to abortion are not only burdensome and unjust, now they're also dangerous, risking patients exposure to the virus and transmission to others. We may not know what the coming months will bring on Beacon Hill, but here's what we do know. Advocating for reproductive health care is critical for people across Massachusetts, especially now. Given the constraints of the current legislative process, the ACLU and its partners in the ROE Act coalition are asking the legislature to keep this issue on their agenda as they move beyond the present emergency. And we're continuing to build our base of support. Things could move rapidly on the state and national level, and the ROE Act coalition will be nimble to meet the challenges of the day. Our advocacy may look different as we gather online rather than rally at the State House, but as we evolve, we grow stronger. Thank you for being a part of this movement.
Thank you so much, Omi and Gavi. Now, I want to remind people that we received a bunch of questions in advance, and we'll only be able to get to a couple of them. So thanks for your patience in all of this. Omi, this question is for you, and Margaret from Concord asks it. It's about the national picture and really constitutional law, but people are wondering, can the Supreme Court undo accepted law, such as Roe v. Wade?
Yes, unfortunately, the court can always overturn its prior rulings, including in Roe v. Wade, and we know that anti-abortion activists and groups across the country have been filing lawsuits hoping just for that result. But the truth is the court and many states have been chipping away at abortion rights since Roe was passed, which is why it's even more important for states like Massachusetts to continue to ensure safe and legal access to abortion, and that we all pay attention to our elections, because our elected officials have the power to appoint and confirm judges who are ultimately making these decisions.
Thanks, Omi. Gavi, we're going to pivot over to you. Emma from East Hampton is on now, is wondering how people in Massachusetts can get in a fight to protect reproductive care in states like Texas and around the country, not just here in Massachusetts where they're equally important, but in states where there are really serious issues at hand to people's access to abortion.
Sure, that's a good question. I would recommend that you sign up for updates at ACLU.org to learn how to get involved in the fight for abortion rights in states like Texas or in other states. But I think it was Tip O'Neill who said that all politics is local, and we need you here in the fight in Massachusetts. As I mentioned, the ROE Act is a bill that would improve access to abortion right here. And at a time when other states are exploiting the pandemic to ban abortion, Massachusetts really has an obligation to lead. So you can take action today. We're dropping links in the chat, or you can sign up for updates on our website at aclum.org.
Thank you so much, Gavi and Omi. We're now going to move on to the voting rights portion of our show today. Rahsaan Hall is here to talk to us. Rahsaan, thanks for joining us. Please tell us what's happening right now during these difficult moments during the pandemic relating to voting rights.
Thanks a lot, John, and good afternoon, everyone. Thank you all so much for joining us on this virtual town hall and taking time out of your schedule to hear about these important issues that concern all of us. I'm going to share my screen and tell you that the vote must go on. This crisis may well be with us into November, and the ACLU is committed to ensuring that nobody has to choose between their health or the health of others and the right to vote. You see in this picture, it's a beautifully complicated picture. It's an image of a lot of people who are standing in line to vote. They all have protective gear on, and it's a significant number of people of color. But the sad part about this picture is that this is a picture of people who are forced to stand in lengthy lines, some of whom don't have protective equipment because of the fiasco that happened in Wisconsin, as we saw in their primary, failing to provide voters with opportunities to vote by mail and safe options for voting in person, put the health of our democracy itself at risk. Early turnout numbers from Milwaukee show a massive drop in turnout from over 167,000 in 2016 to between 75,000 and 115,000 this year. You'll see that the majority of states, 34 states plus DC, already allow all eligible voters to cast their ballots by mail. They include states across the ideological spectrum like Colorado, Florida, Georgia, Michigan, and Utah. Here in Massachusetts, the ACLU has been working with lawmakers and other advocates to push for legislation which was recently introduced, House Bill 5075 or House Docket 5075, an act ensuring safe participatory 2020 state elections in response to COVID-19 that was filed by Reps. John Law and Representative Michael Moran. What this bill essentially does is ensures that taking precautions related to COVID-19 will continue to constitute a physical disability for the purposes of requesting and casting an absentee ballot. It requires that the voter registration ballot, that voter ballots be mailed to all registered voters for the November general election. It expands the deadlines for receipt of mailed ballots. It allows for central tabulation of those ballots. It expands early voting, and it encourages regulations requiring public health safeguards for in-person voting that is still very essential. There will be a hearing on this bill as well as several others this Thursday. Massachusetts leaders must act immediately to protect voters' safety and our democracy, with particular attention to communities of color, low-income communities, people living with disabilities, and other peoples. Communities of color in particular are being hit hardest by the COVID-19 That is why ensuring robust vote by mail options and in-person voting options are enacted, funded, and maintained. If you look at this impact map of Boston, you'll see the correlation between the locations in the city of Boston with the highest rates of COVID-19. And then when you overlay, looking at the map on the left, the percent of non-white residents. The recent list of the municipalities with the highest rates of COVID-19, you'll see that the top three are all majority minority municipalities, and some of the other ones have significant populations of people of color like Lawrence and Everett and Revere. Language access is also language access protection is also essential. You'll see that there are jurisdictions that are required to provide translated language ballots for people, but we need to ensure that that information is available to them in the instructions, especially when we're pivoting to absentee voting or voting by mail. The ACLU, the national ACLU, is now calling on Congress to pass a COVID-19 relief package that includes a mandated 14-day minimum early vote period, no excuse mail-in absentee voting, and at least $4 billion in federal funds, the amount required to make early voting and vote by mail accessible nationwide. The Massachusetts congressional delegation has been in support of the call for $4 billion in federal funds for the fall elections. Here in Massachusetts, we've advocated for a few key principles to carry through this voting protection, which is dedicate resources to enable widespread absentee voting, preserve in-person voting while taking steps to protect voters and poll workers, and expand early voting. The bill that we are supporting does these things. And so whether you're in Massachusetts or nationally, we ask you to stand with us and call your elected leaders and encourage them to support passage of HD 5075 because our democracy is at stake. And the decisions we make during this crisis will have an impact on our country and our Commonwealth for years to come. And lastly, don't forget to wash your hands and take the 2020 census if you haven't already.
Thanks, Rahsaan. Really appreciate it. Listen, we got a couple audience questions, and I think the first one really reflects, I think, something that a lot of people are thinking. Rebecca is wondering what the current vote by mail situation is, not just here, but nationwide, particularly in swing states. I mean, that question really points to we've got a massive federal election coming up. We've got a massive presidential election coming up. Where are things at? What's the status of vote by mail?
So there's only 5 states that conduct all their elections by mail, and that's Colorado, Hawaii, Oregon, Utah, and Washington. But in total, 35 states or 34 states plus DC allow any registered voter to request a ballot so they can vote absentee. There are some states that this is a temporary allowance because of the coronavirus, but other states that offer vote at home require an excuse, and Massachusetts is currently one of those states that requires it, such as being out of town, being deployed overseas.
Got it. Helpful, Rahsaan. Got another question for you to close out the voting rights segment. Ted from Concord is wondering if the virus extends to November, and we all know that that's a possibility, how can states legally require voting by mail? Is that possible?
So there are several states that are moving in the right direction. Just last week, the California governor signed an executive order to make sure every registered voter is mailed a ballot in November. And here in Massachusetts, again, the ACLU and our advocates, we've worked with Beacon Hill lawmakers to fashion a bill that would protect the rights of all voters in Massachusetts. And among the provisions that protect in-person voting, the bill would require the Massachusetts Secretary of the Commonwealth to mail every registered voter a ballot for the general election. And so you can act today to tell your lawmakers to safeguard the 2020 elections by co-sponsoring this bill and being supportive of it.
Super. Thanks again, Rahsaan. Really, really appreciate that information on voting rights. Again, people visit ACLU of Massachusetts website. You can find out more about our work on these issues and take action. I want to close out today by saying thank you, but also to introduce Carol Rose, our Executive Director, who's going to offer some final comments to everyone. Carol, thanks so much for being here. Go ahead.
Great, thank you, John, and thank you everyone for being with us today. It's great to see so many people. So as you heard from our advocates today and throughout this town hall series, the ACLU's work of defending civil rights and civil liberties continues. It's essential as ever. COVID-19 has really upended all of our lives in unimaginable ways before. But the need to defend the country's most fundamental values, our democracy, our liberty, and vulnerable populations, it's more essential than it's ever been before. Since the start of this pandemic, the ACLU nationwide has filed over 100 legal actions to keep voting safe and accessible, to defend abortion rights, to protect the health and well-being of incarcerated people and people in ICE civil detention. But as we move through this emergency, we're going to continue to fight both here in Massachusetts and nationwide to ensure that any temporary intrusions on liberty are lifted as soon as possible, narrow as possible, and don't become permanent. At the same time, I don't know about you, but after a few weeks in this public health crisis, I am pondering, what are the changes we might want to keep after this emergency? Can we envision a world in which fewer people are incarcerated, in which we eliminate unnecessary travel, or where voting rights becomes more widespread, more people get to exercise their franchise? Can we envision a world where we share greater awareness of the need for racial equity and equality, greater access to medical care and telemedicine and abortion care, stronger privacy protections? What kind of collective action are we learning how to do now that we can defend both public health and civil liberties at the same time? I think that's the challenge before us, and I think it's a hopeful challenge that we can do together as the ACLU, and that includes all of you. And one thing I'd really like to see more of, and we're going to try to build it with your help, is more of a platform and more opportunities to hear from all of you, our ACLU members and our supporters. There is strength in numbers, and together we can face this crisis and find a way to turn it into transforming our world to defend freedom and liberty for all people. So we need you to stay in touch, simply put. I hope if you haven't already, sign up for our updates at aclum.org. Stay tuned for new and continued ways to engage with the ACLU here in Massachusetts and nationwide. I think in the chat, we're going to be putting in some ways that you can sign up and stay engaged. And let me tell you, your calls to legislators make a very big difference. Your voice has an impact in the Massachusetts legislature, even if it's a thank you call, maybe especially if it's a thank you call, because they count heads, and those votes that come in make a big difference, or the calls that come in. And finally, I just want to tell you, so the ACLU, we don't accept government money. We're not getting any of that PPE or CARES money. Instead, we're actually relying on you, our members and our supporters, to keep this work going. So if you are able, I hope you will consider a generous gift to the ACLU at aclum.org/donate. Just so you know, your financial support is split evenly between the Massachusetts affiliate and the national affiliate, and then it goes out to all 50 state affiliates across the country. So you don't have to choose. We're one big, happy, affiliated network of ACLUs. And when you become an ACLU member in Massachusetts, you're automatically a national ACLU member as well. We don't fight about money, so we're able to work well together. And that's one of the part of the secret sauce of being part of the ACLU. So thank you, stay in touch, and thanks for all you do for the ACLU.